Hey guys, welcome to my video presentation on the dart thrower's orthosis. The dart thrower's orthosis is designed to provide controlled motion in the dart thrower's plane, allowing for radial extension and ulnar flexion while inhibiting flexion and extension of the wrist. It allows for specific glided oblique motion of the wrist that is important for most ADLs. The scaphoid lunate ligament is the major ligament that connects the scaphoid and the lunate carpal bones, and it ensures that bones move in a unison so that the wrist can perform smooth rotation and provide stability within the wrist range of motion. Injury to this ligament may result in pain, swelling, loss of grip strength, bruising, and may be indicated by a popping sound or a snapping sensation. Pain is likely to occur on the thumb side of the wrist during any types of weight-bearing activities. Generally speaking, for treatment of the SL injury, we're focusing on protecting via immobilization in order to regain functional strength and motion. There are non-surgical treatments such as splinting and casting, along with use of anti-inflammatory medications. But if it's that bad, then there are also surgical options that include arthroscopic treatment to repair a fully torn ligament. Ligaments could also be debrided so that healthy tissue can grow and heal the injury faster. And in most severe cases, the SL can be repaired by sutures that are attached to bone in order to realign the scaphoid and lunate, and they are usually held together with pins. The purpose of the orthosis is to provide a degree of wrist stability for healing, but still allow limited motion for functional activities. We want to, again, restrict flexion or extension of the wrist and reduce pain. The materials listed for my presentation came straight from the Orphit website, and there are a couple examples here, but mostly for the base, straps, and other components, elastic-based products with a non-stick coating are recommended between 2.0 and 2.4 millimeter in thickness. And the best part about these materials is that they are easily able to conform to the wrist and hand anatomy, as well as the bony prominences. According to research that I found and Orphit, a circumferential design is recommended. However, I have not seen any pictures or read any research indicating that this orthosis would in fact go all the way around the forearm and hand. But mostly, I think it's important to note that the proximal and distal sections are made as one orthotic and then cut into several pieces. The proximal and distal sections are then connected by either leftover materials or another stabilizing item, and it's meant to be lightweight and comfortable, and both the hand portion and the forearm portion are secured via a strap on the ulnar side of the orthosis, similar to the ones that we made in class. Now, the proximal portion of the orthosis strips are fixed via dry heat, or you can get creative in how you do it, and the distal portion of strips are fixed via a rivet on the hand that will still allow an appropriate range of motion. As far as positioning goes, since this orthosis is made as one complete piece and then trimmed into their respective sections, a specific degree of flexion or extension is not necessary. Of course, however, it is important to keep the proximal and distal palmar arches free for full use of digits. The thenar crease should also be considered to allow thumb opposition, and the radial side of the hand covers the CMC joint but not the MP joint. Anchors to prevent flexion and extension of the wrist will be located near the thenar eminence on the volar side of the hand, as well as the dorsal side close to the web space between the thumb and dorsal radial wrist. So the top row of photos is just to demonstrate what the dart thrower's plane looks like, and the bottom row of photos are to show you the three primary pieces of the orthosis, including the hand, the forearm, and then the protection piece that stops the wrist from going into flexion or extension. And as you can see, the portion that's secured to the forearm side is usually done with dry heat. But as I said, you can get creative with how this is done. You'll see in some other photos how different therapists have done it. And the part that's on the hand is actually connected on the opposite side as well. You just can't see it in this picture. And that's connected via a rivet that still allows the hand to go in the motion of the dart thrower's plane. So the best way to determine what position is most comfortable, pain-free, and allows the wrist to move in the appropriate range of motion is to have the patient hold a pencil with both sections of the orthosis on, go through the range of motion in the dart thrower's plane, ID the pain-free range, and utilize the connecting material to reflect that pathway. Movement is designed to be comfortable within the dart thrower's motion and inhibit flexion and extension of the wrist. So the main purpose of this orthosis, like I mentioned earlier, is to provide stability and reduce pain while allowing functional patterns of motion and block unwanted motion. So while this is considered a functional orthosis, we still want to recommend that our clients wear it around the clock while they're awake, minus for bathing or prescribed exercises. It is recommended that a prefabricated or static wrist orthosis in the neutral position is worn during sleep in order to provide that continued stabilization. And here you could see just several different viewpoints of the same orthosis on the same hand and wrist. So you could see the connecting piece as well as the Velcro straps that are securing the orthosis in place.